Hi, today on Real Nurse Stories, I'm thrilled to introduce Trina Pitts, who is a nurse, and Trina's also a coach. We're going to hear a little bit more about that in a moment. So, welcome to Real Nurse Stories, Trina. It's lovely to catch up with you again today.
Thanks, Eva. Eva, thanks for having me as well. I'm super excited about our conversation today.
I know, me too, me too. I always enjoy these conversations because we cover some great topics. So I'm really thrilled to be able to give you this opportunity today. So where I'd like to start, Trina, is right back at the beginning, and I'd like to ask you just to share with people listening why you decided to become a nurse in the first instance.
Sure. Well, it goes all the way back to when I was a teenager, which is probably a lot like same for a lot of us. I probably would have been maybe 15, I reckon, when I decided I wanted to become a nurse. Prior to that, I actually wanted to be a teacher. And I thought that that was it for me. But I was actually staying with a friend at the time, and her family actually were visiting a friend in hospital, and so I kind of had gone along for that visit and just sitting there quietly. And I guess I'm a bit of an observer anyway, but I think in those situations where you don't know the people you're
Yeah,
visiting, I definitely was sitting and just observing and watching what the nurses were doing and the care that they were providing and how kind and caring they were. And from that moment, that kind of just changed my mind. From there, I was like, "Oh, this is what I want to do. Like, I want to actually help people." Like, I guess at the time I didn't probably have the words, but it was around that, like in those vulnerable states,
yes.
help people with their health and to get them better. And yeah, so that kind of was the start of wanting to become a
Hmm.
nurse, and which was probably good timing because I was at the time of like working out subjects and everything for school. So that kind of led me then into nursing and doing my degree, and also working as an assistant in nursing while I was doing a degree as well.
Mm, mm. Did anybody ever try and talk you out of becoming a nurse?
No, no, not that I can recall actually. No.
No.
My grandmother was she did do some nursing. I guess back in the day it wasn't fully qualified through the universities and everything. It was more hospital trained. So she had worked for a period of time in a hospital, in it was actually a mental health hospital. So I think that my family were just excited for me, I think, and thought it was a good path for me, but yeah, nobody had actually ever tried to talk me out of
No.
it.
I'm just curious because sometimes people do. I remember my dad always tried to talk me out of it. Why don't you want to be a doctor? And he had
Yeah,
other ideas, but I was determined that's what I was going to do. So
yeah.
yeah. So you went off to do your training, and then what happened? Did you specialize, or how did you?
Yeah, look, funnily enough, I was so keen. I think, like a lot of students, we have like some people don't know what they want to
Mm,
do, and other people have got a really set path of what they want to do. And I was probably one of those people. I've always been quite goal orientated, setting out my goals and trying to achieve them. And so I think during my student days, I knew that I wanted to become a pediatric nurse.
okay.
And interestingly enough, it's not what I ended up, the path that I ended up taking. I sought out during my student days, I actually sought out my own pediatric placement. I lived in New South Wales at the time, so I'd
Mm,
actually travelled down to Sydney from Newcastle and organised my own placement just so I could have a placement in a pediatric ward. In my grad year, I actually gave up my critical care placement because they were short on critical care placements, and the
mm,
guarantee was if you gave it up you would get your first preference. So I gave that up so I'd get my pediatric rotation.
okay.
And funnily enough, at the end of my graduate year, I was all set and thought that that's a path that I was going to take. And I had done a rotation in a general surgical ward. And I ended up doing general surgical nursing for the first couple of
Oh, wow.
years of my career before I found myself in critical care, which is what I'd given up,
Yes.
and became an ICU nurse. And that was really, I guess, my niche and my love was the
Mm,
ICU nursing. Yeah.
mm. What did you love about it, Trina?
The ICU nursing, I think it's probably, I'm a bit of a perfectionist. So I like in ICU, it's like that one-on-one care. You can really deliver thorough, in-depth care,
Mm,
the continuity of care. It's quite structured. So that worked for how I function. And I think just the technical side of it, like I really love the technical skill side of nursing, and there's just so many skills to learn, but it does also couple with your theory and your knowledge, obviously. And so I'd kind of gone in there because I wanted to become an educator. So as a grad, that was my dream role of becoming a nurse educator,
mm.
and I thought it would be a good stepping stone to actually really embed my clinical knowledge, but also my clinical skills. And ICU is quite tech driven, and
Yes.
whilst I wouldn't say I'm overly tech savvy, I do really love learning technology when it really helps, and
Yeah,
makes things more efficient. So I think that that's like the main things that I really loved. And it's a nice, quite close knit team as well, like
yeah,
even like multidisciplinary, like everyone knows one another. It's a closed unit that you kind of work quite closely together
yeah.
as a team.
It's really interesting that, isn't it? Because I think there's many protective factors in a team that's very cohesive like that, and it is, as you rightly describe, it's a very technical environment, and you're seeing obviously some of the sickest patients in a hospital, but that connection with team is such a protective factor, I think, because it's a
Absolutely.
challenging environment to work in as well.
Yeah.
So I find
Yeah.
that fascinating.
Yeah, I think that's one of the things I just love about nursing, though, is like the team that,
Yeah,
like it really makes or breaks your experience as
yeah,
a nurse, I think, is that the team that you are part of.
yeah,
Mm,
absolutely. I would agree with that.
mm.
And what do you think, Trina, when you look back a little bit at your career, what were the times that were the most difficult times, do you think? Because I know lots of nurses I speak to and interview for my podcast kind of have experienced that. And I think, that it's good to be able to share some of those experiences.
Yeah, and I think there's probably been a few times throughout my career, certainly coming out as
Mm,
as a newly graduated nurse. I think everyone would say the same thing. It's always a challenge. I went straight into my nursing degree from school, so
yeah,
I was a young nurse coming out, and whilst my grandmother had been a nurse, I didn't know her as a nurse.
no,
That was, I think, prior to my time. So I didn't kind of have anybody in the family at the time that was a nurse. So didn't really have that in depth
mm,
understanding as to what it truly was going to be like. And I think, there were challenges. Part of the challenges was shift work. I didn't really kind of expect the challenge of what shift work
mm,
was going to bring, doing all of the rotating shifts that you have to do. Uh, but also just, you don't get a lot of clinical hours as a student.
no.
Um,
Mm.
all of a sudden, you know, you're registered and you're expected to perform. And so it's really like you're freed and off you go and fly.
Yeah.
And yeah, it's just pulling all that theory into
Mm.
practice. I did have some pretty good support in my graduate year, I would say. I had some good clinical educators that were really helpful and some good staff. I also had some other experiences. I still remember today one experience with a older nurse where I was doing something that wasn't to her liking, and the way that she kind of responded and spoke to me and reacted, and the
Mm,
behavior that still sticks in my mind today.
mm.
And I guess it's taught me what not to be like with new nurses,
Yeah,
because we're all learning.
absolutely. And I think as an educator, because I know you referenced, that's something that you're passionate about, and it's almost like a memo to self, isn't it? Not
Mm,
to be like that.
absolutely,
And I,
yes.
I think what you've described there is not uncommon. I think I always remember, we had a really good senior lecturer in nursing, and I always remember her saying when we'd done all our exams, and she said, the minute you put on your qualified nurse's uniform, she said, people don't know whether you're 1 day qualified, 3 years qualified. And I can remember thinking, what's she mean? And
Yeah.
then, that moment arrives and you get it. But
Yeah.
boy, do you get it. You suddenly realise that, I'm supposed to know the answers to all
Yeah.
these things. And it's in many ways terrifying, but it's also a milestone because you qualify, but it's equally terrifying because
Oh,
you are expected
absolutely.
to know.
Yeah, it's that crushing feeling of the expectations that are put on you. And I don't think that that hasn't changed. Like, I work with grads quite often
Yeah,
these days, and they still put that same high level of
yeah,
expectation on themselves. And it's probably um, the nurses that they're working with, the pressure that they're under, they tend to forget that sometimes that actually they're just 2 months out. So we
yeah,
just need to have some realistic expectations here. So yeah,
yeah.
it's definitely a challenging time, that first year or so.
Yeah, I think so.
Mm,
I think also grads can be really hard on themselves in terms of their expectations, and we don't really prepare, I don't think, very well for the reality of that. You kind of qualify, you get a grad place, the euphoria of that wears off, and then suddenly it's like, oh, there's all this stuff that nobody's actually mentioned, and I think that's really challenging to deal with.
absolutely, yeah. And I think the challenge is that we really struggle um, to provide the adequate support
Mm,
to nurses in general. I think, I know in our organisation we have a grad program and there is some support there, but sometimes it's actually just not enough. And then it's not enough then to also support the nurses that are supporting them as well, kind of the kind of mid-career nurses and
yeah,
later career nurses kind of get lost with that support. They get left out because
yeah.
the focus can be quite so much on the newer nurses as well. So yeah, it's very much a challenge, ensuring that there's appropriate support provided for
Mm.
everybody.
I often wish that somebody would do some kind of more in depth research around that because, if you think about all the different generational mixes in nursing and just the different approaches that, we've all kind of come through the different um, kind of eras of training, and that in many ways I think sometimes does explain some of the approaches. I'm not saying that I agree with that necessarily, but I think it helps us to understand that. And I don't think that we actually see that in the round enough in terms of how all these generational kind of nurses come together in one place, and perhaps with different expectations or different, well, in our when we trained, we didn't have that. And there are elements of that. I've heard people say that. And I've also heard people not be so helpful to grads who, well, we just
Mm,
had to suck it up and get on with it. And,
yes.
you know,
That
which is,
grinds my gears when I hear that.
I know, me too. I'm like, says who?
Yeah, absolutely. Like, why should we be normalizing something just because
No,
we've put up with it through
yeah,
our nursing career? we should not be normalizing
No.
what we've had in the past that wasn't necessarily right. We need to be working towards change, and I think that it's about us all working together, all
Mm,
generations working together to actually move
mm.
forward for a better future for nurses and, create a sustainable career for us all.
Yeah, I agree. And I think, it will require in many ways different approaches. And it's like anything, there isn't a one size fits all to the scenarios that, we know happen in nursing. I think we have to have those discussions that there are multi methods and multiple ways that we actually need to consider in terms of how we support both, graduate nurses, student nurses, nurses who've been in the career a while.
Mm,
And I think also we don't think about nurses who maybe want to stay in nursing but less hours and less responsibility. There's still a role there, but we don't hear those discussions either. So
no,
I find that
and I'm fortunate that in my employed nurse educator role, I get to talk to a lot of nurses, far and wide in all different levels,
fascinating.
and there are challenges all the way through your career. Some of what we've just discussed as a new graduate nurse, but then as you move through your career, like we're predominantly female, so women are having babies and then having to um, juggle
Yeah,
between being a new mum
yeah,
and nursing, returning back to work. And then as you move further into your career, like I've got two girls, they're teenagers, and that was certainly a challenging time for me
yeah,
when I had my babies. Um, now I've got the challenges of navigating through teenage years. And, then there's nurses that are working towards, retirement and
mm,
want to actually have some more flexible working hours, or
mm,
maybe they've got um, elderly parents that they need to care for as well. Like we've all got our own challenges, and I find it interesting because whilst we do shift work, I think that nursing can be seen as a bit of a flexible
yeah,
profession or job to have, but it's actually not. It's
no,
quite rigid.
yeah. Especially, if you have young family, I think
Mm,
that's always the tension. The hours don't really fit. They're not family friendly hours,
mm.
and that places additional stresses, I think, on nurses who are already in a pressurized system. And
Absolutely. Or couples. Like I know
yeah,
so many
absolutely.
couples that they're both nurses and
Yeah,
they're trying to juggle both of their shift works around their
yeah,
children or family or
yeah.
commitments or whatever it might be. Yeah.
I know that you gave some topics, Trina, and I know that these topics are very close to your heart, and I'd like to give you the opportunity just to talk a little bit about those. And the topics that you gave me were importance about of nurses prioritizing their well-being, the guilt and shame that nurses hold, and then burnout and workplace bullying. So they're some of the great topics that I know you wanted to talk about today. So tell me a little bit more about that and why you're passionate about those topics.
Yeah. Oh, look, where do I start? Look, I think I'll start with my experience, I guess, and what's
Mm,
led me to become more passionate about this. I've probably talked a little bit around being quite goal orientated and goal driven,
mm.
and that certainly has been me since I was even a little girl. Like I remember my mum told me that I was creating my own homework as a primary school student and taking it into my teacher to be marked, and they'd never seen that before. So, I'm that kind of high, performance,
Mm,
ambitious, driven person. And I guess going into my nursing career, I was so focused on goals around, I guess more so titles than anything else.
mm,
I was absolutely set on becoming a nurse educator. And I think sometimes we can set ambitious driven nurses can set their path and be like, well, this is what I want it to be. And then we're constantly trying to prove
Yeah.
ourselves. And so even when I finally landed my nurse educator role 10 years ago, I dove into it full time with a 2-year-old. My other daughter was almost at school age, so I had 2 kids not quite at school yet when I first started, and I went back to work full time. And it was purely because I thought, "Oh no, like I need to dive in head first here, and this is what I've wanted for such a long time."
Yeah.
And it's almost this sense of feeling like that you need to prove yourself.
Yeah.
And I think in reflection, um, what I've learned over the last couple of years is that that's kind of led to my own burnout. Lots of other things. There's been personal and professional reasons, but certainly my own ambition has certainly led to that. And I think also just that guilt and shame, like, that um, there's all this care that needs to be provided. You can see the gaps, I think, as nurses and what
Yeah.
needs to be done. That's that's what we're experts at assessing, aren't we? And and and,
Yeah.
and identifying what needs to be done,
Yeah.
and we take on that responsibility a lot ourselves and think,
Mm.
okay, well, you know. I've got to do it because if I don't do it, then who else will do it? Or if it
Mm.
doesn't get done, then the patients will suffer or someone will suffer. So I think I'd spent, a lot of time in my nursing education days, not only thinking about patient safety and how that can be improved, but also wanting to make sure that I'm supporting the nursing workforce as well, because you can see what's going on for them. There's a lot of self sacrifice that
Mm.
happens in nursing. Um, and then I guess, with the workplace bullying, I hadn't actually recognized my burnout until I experienced workplace
Mm.
bullying, and both of them collided. I ended up having a complete breakdown, which almost caused me to leave nursing.
Yeah.
And I think from there, when I started talking to other nurses about my experience, you realize how many nurses are actually suffering through these
Mm.
similar stories in silence. Like the amount of nurses out there that are experiencing workplace bullying,
Mm.
toxic workplaces, burnout, get the guilt of not doing enough when
Yeah.
they're working their butts
Yeah.
off all day and doing the best that they can and showing up all the time and generally doing, extra shifts, extra hours,
Mm.
extra work, not taking their breaks, and then feeling guilty if they do say no
Yeah.
or not taking their breaks. I actually, when I started on my healing journey after burnout and bullying, I actually set some boundaries. And one of those boundaries was to actually make sure that I started taking my lunch break. And interestingly enough, I was out side sitting one day, and I had a couple of nurses walk past me on their day off, and
Mm.
their comment to me was like, "Oh, nice to see that you've got time to take a
Yeah.
break."
Yeah.
And instantly I felt a bit shamed and
Yeah.
felt guilty, but I think I it didn't last long because I knew at that time, like, this is what I need to
Mm.
do. They don't know what I've been through.
Yeah.
But I think the problem is that a lot of us are actually got a lot going on, whether it's from the workplace, like
Mm.
burnout, bullying, or it could be actually personal issues. And we guilt and shame ourselves, but we can guilt and shame one another as well. So I guess that's kind of why I'm so passionate about it, because it's definitely something that I'd like to see change
Mm.
in nursing.
I find it interesting because my focus is very much on leadership, and a lot of what I talk and write about is how a leader sets the culture. And I think where you have a leader that role models that whole taking a break themselves, but enabling others to take their breaks. You can actually see that where a leader does that, how that impacts positively on a team. And equally, when I say that, I know that there's a lot of scenarios where that doesn't happen. And it's almost like, as a leader, you have to go against the groundswell to be leading differently. And those are the conversations that I have a lot with leaders around. You don't have to emulate what we've always done, because what we've always done doesn't always help the teams that we lead. And I think to be able to go against the flow requires you to put your big girl pants on or big boy pants on, because there is this expectation that you follow. Well, this is what a leader in healthcare looks like and behaves and does. Well, I disagree with that, but I find it fascinating that we have this culture, and I get where it comes from. You described that really well. We carry that guilt and shame, because if we can't all take a break, then it's very difficult for one person to do that. And I think the other interesting thing I just wanted to pick up from what you said there was not recognizing burnout, because what we know about burnout is invariably it's other people who see it before we become aware of it. So we kind of carry on. And a lot of it is personality shaped based on kind of how you, if you're very goal orientated, which you were, and it's like we have a standard, and that can work in a negative way, as you've described really well. But I think not recognizing burnout is a huge problem. And also, it's like when people recognize it, they don't always know what to do. How can I help this person? I can see that. And some of the signs, as I know Trina, are around that becoming disconnected. You lose that compassion for self and others in your care. And that's because of where you are in this, trying to juggle all of these things, and no time for self, no time for breaks. And I think it's a really challenging position to be in, and it's a very lonely position, actually. I think, for someone who's going through that. So what happened? Tell me a little bit about, you were struggling with these things. What happened from there for you, Trina?
I think the thing is like I said, it took the bullying to actually, for me to realize. I probably didn't realize how burnt out I was until I started on my healing journey and started to reflect on the previous years and the previous 10 years, and really think about all the things that had happened professionally and personally, and that pushing through, with young kids and full-time work and all of the things. And so I got to a point basically where I had gone from, I guess, this high performing nurse showing up, really productive, and now I guess on my way to work, crying to work, dreading work, crying at work, trying to hide so nobody would see me cry and see what I was going through. And I was no longer productive at work. It was definitely affecting my performance. And I think I recognized that. I knew that I had to get out of that situation that I was in, because I still, I guess, the position that I was in, I did have the person that was bullying me still around. So I chose that this isn't going to resolve itself. Even though it wasn't through lack of trying, I certainly did try and improve that relationship. And I just decided to take a secondment. I thought, enough's enough. I can't function like this. I'd literally, I felt completely broken, I guess, and really felt dysfunctional. So I chose to actually go, I need to go elsewhere. I didn't want to give up my
No.
position at the time. So I started looking around for secondments basically and, seeing what was out there. And fortunately, something came up fairly quickly and it was in like project work. So it was something that I hadn't really done before. I'd done a lot of quality activities, but not like big change management stuff. And so I was quite excited because I just finished my postgrad the year before on health services management, which included a lot of change management. So I had that opportunity to now actually put into practice what I'd learnt through my postgrad. But I did find the role, like as a project manager, far less stressful
Yeah.
than nursing. Even though I was still employed as a nurse in the project role, it gave me the space, I think, to really start my healing process. I removed myself from the toxic environment that was, and yeah, started that healing journey, setting some boundaries, taking rest. I think I said to my husband, like, this year, I don't want to do anything. We're not planning anything on weekends. We're not taking any holidays. And this comes from someone that loves
Yeah.
taking holidays and enjoying time with my
Yeah.
family. But I just needed rest. And I
Mm.
needed to give myself permission to actually rest without the guilt.
Mm.
Mm.
What do you think would be, if you were to go back in time, what would have made a difference to you, Trina, do you think, if anything,
Mm.
in terms of managing all of that? Because, I always say this to people, you always have a choice. If something isn't working, then, you do have a choice to find a way, an exit strategy, and move to something else. But in terms of how that leaves you as a person, and you referenced healing there, I'm just wondering, is there anything that would have made a difference to you back then, that's that kind of with hindsight now, knowing what you
Yeah.
know?
Look, I think the thing is that we are so conditioned as nurses to be a certain way, and we've been taught to suck it up and just get on
Yeah.
with it. And I think, in a sense, we're kind of taught that in our personal lives as well. So I think, nobody ever really teaches us the self care
Yeah.
aspect. And I think at the time, I was so angry with the system for
Mm.
not actually doing something about this
Mm.
and not addressing the bullying. And then when I started talking to other nurses that were going through the similar thing, that just kind of exacerbated my anger and frustration because I was like, why is nothing happening? Why is
Mm.
this being let continue to happen? But I think on reflection, in hindsight, and this is, I guess, where it was just taking that responsibility for myself, and really honing in on, like, what can I control? I
Mm.
can't control the system. The system's a beast. It's very
Mm.
strange. That's not going to change in a hurry. And everybody, like, I don't think that many people, like, there might be a very small percentage, probably, if any, that most of us are coming to work and just trying to do our best
Mm.
under the conditions and the pressures that is
Mm.
within healthcare. And so I don't think anybody's trying to necessarily be malicious. I
Mm.
think there's definitely a gap in leadership training. I
Mm.
think that there's a lot of good leaders, there's a lot of leaders that haven't been supported really well into those positions. And so they're not necessarily willing to have the tough conversations and manage the behaviors and the culture
Mm.
within the system. And so I think I came to peace with that and just
Yeah.
thought, it is what it is, and I don't actually have control over that. I'll influence by speaking up and advocating where I
Mm.
can. But I really need to focus on what I can control, and
Mm.
that's actually taking responsibility for myself and
Mm.
my own self care and making decisions that are right for me. And so it was really revisiting my own values, but part of that, I hadn't realized how much of myself I'd actually lost over that,
Yeah.
you know, probably since I was a teenager. There was many things that even my
Yeah.
husband said to me, "Oh my god, I didn't realize you're into that." Like,
Yeah. Yeah. It's almost like self-empowerment, isn't it? It's like, I've heard many nurses when times are tough, and the talk is it's almost a bit of an eye-rolling moment,
mm,
nothing's ever going to change. It's always this way. And in many ways, acceptance of that situation without the realization that you can change things, you do have a choice. But and I guess again that comes to personality and values. Sometimes people are more outward looking and waiting for an organization who's perhaps not going to ever be able to meet that expectation for one reason or another, and not understanding that actually you do have a choice and you can change things
mm,
personally, and that comes from a place of being empowered. And I think,
absolutely.
I see a little bit of a difference in the grads who are coming through in terms of empowerment. I think there's less and less kind of accepting this is how it is, and more
Mm,
seeking out what's right for them. Just in my circle here in Perth, I hear conversations around people choosing, so having two
mm,
jobs. One is stressful, they acknowledge
yeah,
that, and the other is less so. And that's
less.
a conscious decision to have some balance. And I think that's starting to change. Whereas if we talk about generations, I think a lot of us have just put up with an awful lot,
Absolutely.
and
Yeah.
there's lots of reasons for that. But
Mm,
I also see change, and I think that's good because it has to come from within, and the
yeah.
consequences of not changing for us, individually and collectively, really,
Mm.
have many repercussions.
Yeah, for sure. And I think there's work to be done together, like,
Yeah,
like changing
yeah,
to be more flexible for nurses to accommodate. But I do still believe that, we sign on to be a nurse and we
yeah.
accept a position and we understand what that position means
Mm.
in terms of our responsibilities and our accountability for our role. And so I don't think that that's something to be taken advantage
No,
of. But on the other hand, I don't feel that we should be taking advantage of ourselves and self sacrificing to the point
yeah,
of burnout and breakdowns.
absolutely,
Mm.
absolutely. So, Trina, I'd like to just give you the opportunity now, because I know that you're about to step into your coaching business,
Mm.
and I'd just like to give you the opportunity to talk about that, because I know that you are passionate about working with nurses. So, I'd like you just to share with people what you're doing, and kind of what brought you to that. I think is useful.
Yeah, definitely. Well, I think that there's been this little niggle in me for a little while to I've always like wanted to create or,
Mm,
have something that I've built for myself, and I wasn't really sure what that was. I always had
mm,
in my head that I maybe wanted to write a book or something. That might have been what it was. There's so many notes in my phone and that where I've started writing ideas of books, and anyway, there's always been this niggling kind of thing at me. And I think after my experience with burnout and bullying,
mm,
I did go on a bit of a journey to rediscover myself. And
mm.
as I had said before, I almost actually left nursing. Like I was completely done. I don't know how many times I said to my husband, is it okay if I just like leave? I don't know what I'm going to do, but I think I'm done. Like I can't do
Yeah.
this anymore. And so I went on this exploration of like, well, what is it like rather than starting over?
Mm,
What is my next career direction? And so I really focused in on my strengths and my passions and my interest. And part of the job that I love most as an educator is supporting and helping nurses grow and develop in their careers. If I could do that all day, every day, I'd be happy. But obviously, I'm a little bit limited. I've got a very big portfolio that I look after at work as an educator, and lots of various different things that I've got to do within my
Yeah.
time. And so, yeah, I guess that's what kind of led me to going, well, you know what, I can do this myself and
Yeah.
start my own business. Because I think the thing is that within work time, nurses just don't have the time either. Like,
No.
their whole time is absolutely dedicated to patient care. And it is really hard to actually, I guess, one, heal within
Mm.
the same environments that's causing that stress and overwhelm and exhaustion. But two, I guess, be focused on self and your
Mm.
self care. And I think that's what I learnt, is that I invested in a coach myself when I was going through my burnout and bullying towards the end, and realized how impactful
Mm.
it is, because it's kind of just, I guess, it's that support and guidance that you
Yeah.
need, and somebody to actually reflect back to you what
Yeah.
you're saying and thinking about, and encourage you and help you find that confidence to do what you need to do. And so that, I guess, that's led me on my journey and of coaching. And I guess, the nurses that I want to be able to help are the nurses going through a similar thing
Yeah.
than what I did. There's a lot of nurses that I've spoken to that are in a toxic environment.
Mm.
They're being bullied. They're completely burnt out. They're on a verge of a breakdown, if not already have broken
Yeah.
down, and just unsure of what to do and what are the next steps and what else can I do, because we get so conditioned into thinking that there's just one path forward. And
Mhm.
that was one of my challenges, that I was just looking at my career direction within the system that I knew, which was a
Yeah.
hospital system. And so I was like, well, I can step up to the nursing director role, or I can go to the
Yeah.
side and be a nurse unit manager or a clinical nurse consultant, or I decide to go down and work
Mm.
clinically. But when you actually broaden your exploration and see what's actually available out there, and leveraging your own skills, your
Yeah.
strengths, and your passions, there's so much that's on offer.
Yeah.
And so I guess it's just wanting to be able to help nurses navigate that.
Yeah. It's so interesting, isn't it? Because that's how my journey into coaching nurses started, exactly that,
Mm,
working with a coach. And I think until you've experienced that, it's maybe a little bit difficult to get your head around why
mm,
coaching can help you. And certainly in nursing, one of the things I talk about a lot is that there are many nurses who maybe have never experienced coaching. If you work in a very senior role, you maybe have that opportunity. And, my mission, if you like, I say this all the time, is I would love to have every nurse have
mm,
access to coaching,
mm.
because on so many levels, as I know you totally know, Trina, it makes such a difference, to everything. It's like I always say, it's like having your best friend in your pocket at work,
Yeah.
someone holding up the mirror and saying, "Oh, hang on, let's just change that thought
Yeah.
process." And there's so much value in
Yeah.
that, and
Yeah.
I think one of the biggest challenges has been for me around helping nurses to see how coaching can help them, because I
Yeah.
know the value of it. I know you do. It's just it should be compulsory, really. That's my
Yeah.
thoughts on it. No, it's
I
not,
think
but
the challenge is that it's coming back to that guilt and shame. Like
yeah,
nurses feel guilty for actually investing
yeah,
in
yeah,
themselves.
yeah,
But the challenge of if something like this was offered within the workplace is that nurses are also concerned about confidentiality as
yes,
well.
yeah,
Like if I'm
yeah,
going to talk to this person, who else is going to actually know about that?
yeah,
Whereas actually investing in something externally, and I think that that's what I've experienced in
yeah,
with my coaches is that it's a completely separate space
yeah,
and it's such a safe space.
yeah. And that's a
Yeah.
really valuable point, because I've had clients who've actually said that to me, who, I kind of ask how they found me and why. I like to know why they chose to come to me. And that, when I first heard that, it blew me away. I was like, I had quite a few people tell me how they'd overheard a particular person discussing another person, and this was a coach talking to the CEO or to a senior manager, and they didn't feel that confidentiality in the workplace would um, be enabled for them. And I just think, yeah, that is a barrier, actually, and it
Yeah.
shouldn't be, because, as you rightly say there, Trina, coaching is a safe, non-judgmental,
Mm.
confidential space, unless it's
Yep.
something that obviously, we have a role around accountability.
Mm.
But yeah, it's fascinating. That's a
Yeah.
whole nother topic in itself.
Definitely, definitely.
So, Trina, if nurses are listening to this and they want to find you, how can they find you and the work that you're doing through coaching?
Yeah, well, the easiest way to find me would be just on my social. So,
Okay.
Instagram and Facebook, you can find me at Nurse Coach Trina. I have created a nurse wellness assessment, which is a
Hmm.
free tool. It's specifically designed for nurses to really have that check in with
Yeah.
themselves. We're the experts at assessing patients and recognizing and responding to their deterioration, but I've created that with the
Mm.
nurse in mind and for them to actually have that awareness. We spoke about that. Awareness is really so important in the first step of any change.
Yeah.
And so just having that awareness of where you're currently at, and it gives them their own personalized, I
Mm.
call it their early warning score, just as
Yeah.
what you would do with your patients. And it gives them some insight into maybe the areas that they can start focusing
Mm.
in on. So, and I've got some exciting stuff coming up in the coming weeks. So,
Good.
yeah, they can jump on my socials and follow along,
Okay.
because there'll be more coming on that as
Yeah.
well.
Well, that's great. That's really great. And I think, it's very much needed. You're talking to somebody who, absolutely 100%
They're converted.
supports. Yeah, absolutely. Absolutely. Gina, I'd like to give the last question really to you and say, what would you most like to be remembered for in your career?
Mm. Well, I think it probably sounds a little bit cliche, but I think we all want to make an impact, right?
Mm,
But I think more specifically, I would like to be known as that supportive, caring, compassionate nurse
mm,
that is creating change and positive change
yeah,
within the nursing profession. Um, I love innovation and improvement in all aspects, and so yeah, I think I'd really like to kind of really make that impact in terms of positive change for the
mm,
nursing workforce, because we know that there's concerns, and I
yeah,
think contributing to a sustainable workforce that
yeah,
ensuring that they're capable and have the capacity to do their job, but also looking after themselves.
mm,
So being able to support nurses to still thrive in their career, but also to thrive in their own personal life through that self care and positive
yeah.
well-being.
That's such a great positive note to end on, Trina. And I just want to say thank you to you for sharing your insights today. It's always a pleasure to talk to nurses, and there's always so many things I think that listeners listening to your episode will take away. And I think, for me, if you're listening and you're thinking that's how I'm feeling at the moment, then reach out to somebody for help. Don't feel that you have to just carry on and you don't have choices. You do have choices, and that's always important to remember that. So thank you so much, Trina,
Thank you
for
so much for having me. It's been lovely having a chat.
yeah, it has. It has, and you're very welcome.